What's been happening in Ontario is Ford has cut funding for healthcare. He's underfunded the salaries for nurses, for healthcare workers, and he's driven people out of the system. And that has made it far more acceptable to people to say, well, maybe we just need to privatize it. But the reality is, when you have privatized services, more money out of people's pockets, people having to borrow money, beg money, move expenses away from things like food and rent for something as critical as healthcare. What it's going to mean is a real drop in people's standard of living.
A 90-year-old woman in severe abdominal pain brought in by her family. Her assessment, her reassessment, her tests were all done from a waiting room chair.
Doug Ford's policies have made everything vastly more difficult. Bill 124, for example, has led to the demoralization and attrition of healthcare workers. We often talk about nurses, but it's not just nurses. It's respiratory therapists, paramedics, lab technologists, all of whom are leaving their professions in droves because they don't feel valued. And when that happens, that increases healthcare wait times, it contributes to emergency department overcrowding, surgeries getting canceled, and it makes life more difficult for patients across our great province.
We have a message for Doug Ford. Your plan is failing, and it's failing fast. We have watched children's surgeries get canceled by the hundreds. Emergency departments close their doors.
Stress, burnout, thoughts of leaving the profession, but I know that that's not the answer. Starting to just get underappreciated. Longer wait times mean more angry patients. I mean, they take it out on nurses, doctors, and it's just at a point where it's not worth it anymore.